Welcome back to Las Vegas Now. Did you know that 1 in 8 women will develop some kind of breast cancer over the course of her lifetime? And here in Nevada, over 2,000 women will receive a breast cancer diagnosis. JC talked with an expert from Optum Care Breast Care, the sponsors of this segment, for information on how to treat this disease and more.
Dr. Salamat, thank you so much for joining us today. It's a pleasure to have you on the show. And today we're talking about cancer prevention, and breast cancer is such an important issue with women. How common is this?
It's very common, actually. 1 out of 8 women would get breast cancer in their lifetime in the U.S., so that puts your risk anywhere between 11 and 13% lifetime risk of breast cancer, and obviously it's the most common cancer amongst women.
How important is breast cancer screening?
It's extremely important because it's important for us to try to catch cancer at earlier stages and treat it at earlier stages so that leads to better outcomes.
And then as far as early detection and early screening, let's talk about some numbers, or just how important it is to catch things early and survival rate versus catching it early versus catching it a month or 2 after the fact.
Yeah, breast cancer goes from stage 0 to stage 4. So if you can catch things at stage 0 or even stage 1, you're looking at survival rates at 5 and 10 years that are well above 90%. If you don't catch it early and your cancer advances and spreads to your lymph nodes or other parts of your body, that number goes significantly lower in terms of your overall survival.
You guys have the Survivorship program? Tell us more about this.
Exactly. So we have a high-risk program and a survivorship program. A high-risk program is for patients who are at higher risk for breast cancer based on several factors, the most important of which is your family history. So if you have a strong family history of breast cancer, what we do is we take into account all the risk factors and calculate your lifetime risk of breast cancer. And based on that, we might offer you advanced screening. So that's called the high-risk program. Then there is the survivorship program. It's for patients who've already undergone treatment for breast cancer. And we follow those patients closely every 6 months for 5 years, and then usually annually after that. And we attend to their different needs, not only their cancer follow-up, but their overall wellness. I think it's really important for anyone who's kind of viewing this interview to kind of connect to their loved ones and ask their mom or grandma or daughter if they've seen their primary care regarding screening. And that's what we really need most of in Vegas is education, so that we can reach out to more people and let them know what services are available so that we don't wait too long to catch things at later stages. And we're always available here, obviously, and we even have mobile clinics and mammogram units that go around the city. So there's so many offerings. It's just that we have to make sure our patients are proactive in reaching out to us.
Thank you again to Optum Breast Care, Care Breast for sponsoring this segment. They have several locations across Southern Nevada. Call 702-724-8787 for more information or visit optum-cancer.com.